As you transition into young adulthood or go off to college, it's important to be informed about how substances like alcohol and drugs can impact your diabetes. Even if you don't currently use these substances, it's a good idea to feel prepared for situations where you may be exposed to alcohol or drugs. If you do choose to drink, discuss it with your medical team so you can get information on how to do it safely. Talk about any medication you're on and your insulin doses. You may need to modify your insulin doses while you're drinking. It's also a good idea to wear or carry medical identification that says you have diabetes, such as medical alert jewelry, a wallet card, or putting a medical alert on your phone. Why is it important to get information before you drink? First, glucagon will not help treat hypoglycemia while you're drinking. Glucagon won't work until your liver finishes processing the alcohol. When your liver is working to clean the alcohol from your blood, it can't effectively regulate your blood glucose levels by releasing glucose into your bloodstream. Not only is hypoglycemia harder to treat when you're drinking, but because your liver stops releasing glucose, you're also at a much higher risk of experiencing hypoglycemia when you're intoxicated. So if you know that you'll be drinking, it's important to plan ahead.
Hey, my name is Carlos. I'm a junior in college and I just recently began exploring drinking alcohol. There are some ways I prepare for a night of drinking. The first one is by making sure my CGM is transmitting data to my phone, reminding my friends that I need to be careful since I have type 1 diabetes, going to the school cafe so there's food in my system, and lastly, I'm careful with my drink selections by only pouring my own drink and drinking in small portions.
Since glucagon can't help treat hypoglycemia, what can you do to prevent hypoglycemia while drinking? First, know your drinks. Know the alcohol level of different types of drinks and remember that a standard drink is equal to 0.6 ounces of pure alcohol. That's equal to 12 ounces of beer, 5 ounces of wine, or 1.5 ounces of hard liquor. Individual reactions to alcohol vary from person to person, but on average, it takes about an hour for your body to process 1 ounce of alcohol. It's also important to know the carbohydrates in mixers like juice and soda. As you're drinking, keep track of the alcohol and carbs you're consuming. Don't drink on an empty stomach. Eat a snack that has complex carbs and fiber before drinking to prevent hypoglycemia. Stay hydrated. Drinking water can help lessen the effects of alcohol and flush out ketones. Don't leave home without your supplies. Wear your CGM or bring your glucometer, glucose tablets or gels, and fast-acting carbs. Keep checking your glucose levels and adjust accordingly. Remember that exercise, which includes dancing, lowers blood glucose levels. Alcohol can lower your glucose levels hours after drinking. Before going to bed, check your glucose level and eat a snack with carbs and protein. If you drank a lot, you may want to set an alarm to wake you up so that you can check your glucose level later in the night. If you use a CGM, make sure you wear it and that you can wake up or have someone wake you up if your system alarms. If you do experience a severe low, call 911 to get emergency medical help. It's a good idea to educate your friends and roommates about diabetes. Tell as many friends as you feel comfortable that you have diabetes, and make sure they know what could happen when drinking with diabetes. Teach your friends what to do in an emergency, especially because being low can look a lot like being drunk. Friends can be a great resource for help. They can help carry supplies, wake you up so that you can check your blood glucose level, or even keep an eye on your glucose levels themselves if you have a CGM.
My first experience with drinking while away at school has gone well. My friend who was a nursing major made everything easier for me by reminding me to make sure my glucose levels were in range. At the end of the night, I was a little uncomfortable with sleeping alone because I wasn't sure how my body would react since it was my first time. So to be safe, I slept in his dorm room instead.
Like any other drug, marijuana can make you act, think, or feel differently. Some side effects of marijuana include lack of coordination, sleepiness, disorientation, loss of short-term memory, and excessive hunger and carbohydrate intake. What does this mean for someone with type 1 diabetes? As with using any substance, take extra precautions to stay safe and capable of successfully managing your diabetes. Be aware of altered perception. Marijuana may affect your ability to feel high or low in terms of your blood glucose levels. Check your glucose levels frequently and adjust accordingly. Planning ahead can help you manage your glucose levels. Set alarms on your phone to check blood glucose levels regularly. Keep glucose monitoring equipment nearby and bolus for all snacks and edible products you consume.
My name is Dominique, and I've had type 1 diabetes for 13 years. When I use marijuana, I always use it with other people around because it's safer. I've told my friends how to take care of me. If I'm feeling extra slow, my friends know how to check my blood sugar on my phone. If I'm eating a lot, they'll tell me to check my blood sugar and drink some water. As soon as I get a thought in my head related to my diabetes management, such as my mouth is dry, which may mean my blood sugar is high, I immediately do something about it, or at least say it out loud so that my friends hear me and know what's going through my mind.
Remember that everyone reacts differently to substances. For example, some people's glucose levels may go high while others' glucose levels may go low when using the same substance. Your body also may not react the same way every time you use the same substance. Plan ahead and be prepared for different situations. Always remember that you shouldn't feel pressured to try something that you don't feel comfortable trying. That decision is up to you alone. If you do choose to use substances, legal or not, be aware of your surroundings and your body and plan ahead for these situations to avoid experiencing unexpected diabetes-related events.